In today's video, I'm sitting down with Dr. Christopher Peacock, a licensed acupuncturist and TCM doctor who created the Rooted Refuge, a special acupuncture clinic/collective in Queens, New York. The Rooted Refuge model actually makes acupuncture really accessible to pretty much anyone who's interested in trying it. In our chat, Christopher breaks down the science behind traditional Chinese medicine, why it works, and I also got to see him treat one of his patients, so you get to check out why certain needles go where and how it helps to realign the body. Also, you'll discover why treating anxiety or depression or even sleep issues with acupuncture isn't like a one-size-fits-all approach. Christopher explains how your anxiety and treatment could be completely different from mine because we would experience anxiety differently in our bodies. It's not just about sticking needles in the same spots for everyone. It's about really understanding your unique pattern and what your body is actually trying to tell you. Christopher breaks down this fascinating concept about how acupuncture channels your chi through your body, like why treating a headache might involve points nowhere near your head. It completely changes how you think about the body's interconnected systems. This conversation gets into the real stuff, the philosophy behind traditional Chinese medicine and how Western and Eastern medicine can actually work together, and how Christopher's harm reduction background influences his approach to helping patients make some more sustainable changes for better health outcomes. So, grab your coffee, get comfortable, and let's dive into this amazing conversation with Dr. Christopher Peacock at the Rooted Refuge.
Oh, you're welcome. Thank you for coming.
This is an amazing space. You know, I saw photos of it and I've seen video of it, but just walking into it, it just feels so warm. So I wanted to kind of talk to you because I feel like the Rooted Refuge, which is the name of your clinic, has a different approach than most clinics that I see. And acupuncture, as it gains in popularity, I feel like it has this huge range. So maybe you can talk to me a little bit about the beginnings, right? Just kind of, I mean, I know that you are a licensed acupuncturist and you're a TCM doctor. So tell me, why TCM? Like where and why?
Yeah. Well, I grew up in a small town in Ohio, and I grew up with sick parents. And the hospital staff knew me because I was there so much. I was there so much with my parents, and they were never really taught how to take care of themselves, how to, cook for themselves in a healthy way. And they kind of fell through the cracks of the medical system, the Western medical system.
I think that's really common even today, though.
I do too, and listen, we need interventions, right? We need cardiology, we need heart surgeries, we need trauma medicine, we need all these things to pull people out from, the brink of death, right? But I think what thing we fall short on is what got them to that place.
Right.
And they didn't have any of that information. And that was really frustrating to see. Not even to see their lives cut short, which also was frustrating, but it was frustrating to see them not be able to live full and vibrant lives because of their health. They were here until their 70s, and they could have gotten a lot more out of those years. So that was really what made me start thinking about going into this kind of medicine.
Did you have access to?
Well, this is the other part of the story. We did, and I did find my mother, an acupuncturist in Ohio. He was gigantic. He was 6'7", and he was a Chinese man. And he worked as an anesthesiologist at the local hospital, and he had a side practice as an acupuncturist. And the reason I bring up his size is he brought it up the first time we met him, and he said, "You're probably wondering why I'm so tall." And I said, "Yeah, actually I was." And he said, "My parents were acupuncturists, and they treated my growth plates when I was a child so that I would be tall because they're very short."
What?
And I was like, wow. So, I was kind of blown away at this man. And my mother saw him for a few different reasons, and she felt great, and it really, really worked. And guess what else? She couldn't afford to see him. So I kind of watched her find this thing that really helped her, and she couldn't go there. This was 30 years ago. And his price then is expensive now. He was a very renowned TCM physician, and he did really, really great work. But she couldn't afford to be there. So That's part of kind of what informs my practice.
Wow.
Is because I wanted to make a place that was sustainable for people to come. They could come and keep coming, because as you know, this medicine often is not a one-shot deal. It's more of a therapy.
Right, right. A lot of people don't even know what TCM is. It's traditional Chinese medicine. And acupuncture is just only one kind of modality within the bigger realm of TCM. And so you are also an herbalist,
yes,
right? And so there's a lot of synergies that go into like all the things, whether it's, the massage therapies, whether it's cupping or moxibustion, all the things. Can you talk to me a little bit about your approach to treating your patients? What are you looking at? How do you decide whether someone needs acupuncture? Everybody needs acupuncture. But.
Totally. Well, that's the part of the answer. There's acupuncture. There's very few people that wouldn't be a good candidate for acupuncture. There's a few cases where you might not want to do acupuncture, and in those cases, I know how to identify them, and I can refer them out appropriately. But back to the original question, what I do in my approach, I think that everybody needs to be met at a certain place. Okay. My background, a lot of my background is in harm reduction, and the harm reduction philosophy is that sometimes you can't go all the way. Sometimes you can't go, and harm reduction was formed in around drug use. And so when you're working with people from a harm reduction perspective, you try and improve their behavior away from harm. So for instance, a good harm reduction approach in terms of drug use is using clean needles when you inject drugs. A clean needle every time will prevent pathogens and whatnot, infections. And proposing that somebody completely change their diet and their lifestyle isn't always the approach because it can be overwhelming.
Right.
So I look for the next level. The next level. Are you having cold cereal every morning for breakfast? Can you warm up the milk?
Right.
Are you, tell me what your diet's like. What do you like?
And this is TCM.
Oh, absolutely. Absolutely,
right?
Yeah.
Asking them all the questions. I mean, we had talked earlier, and you say that you have a 40-minute intake.
Yes.
Which, of course, in Western perspective seems unheard of. It's like, what are you talking about?
Totally.
So you start with diet, or you start with kind of low-hanging fruit of things that they can...
Absolutely. And I take the reason they've come to me, and I kind of go from there, And, I think the saying rhymes in Chinese, but in English it's essentially, if sleep isn't right and digestion isn't right, then nothing else is going to be right. So oftentimes when people are in front of me, if their digestion is poor, if their sleep is poor, we kind of have to start there. So that's, one angle.
But are people coming to you? Why are people coming to you?
Oh, kinds of reasons. I would say since 2016, psycho-emotional issues are a big one. Anxiety, depression, which leads to insomnia and digestive issues. So, that sometimes is the root. So psycho-emotional issues. I work a lot with fertility, especially fertility within queer communities. I work a lot with reproductive health in general, painful periods, dysmenorrhea, PMS, PCOS, things like that. So those are the major reasons, but like any acupuncturist, I'm going to see my stiff necks and my back pain and my chronic pain and things like that. But primarily...
when you're treating, for example, for any sort of, I don't know, let's say anxiety and depression, right? You're treating the whole body. So there are going to be periphery benefits.
Absolutely. Well, let me break this down. How I look at psycho-emotional issues is this. We like to compartmentalize our bodies. We're trained to do that in this society. This is your head. This is your heart. This is your lung. This is the front. This is the back. They're all separated.
Right.
But actually, how I prefer to, and I think this is true, how I prefer to look at it, and what I think the reality is all those systems are woven together like fabric. And the same is true for psycho-emotional issues. This isn't necessarily a brain issue. This is a somatic issue. And so what I really like, because your anxiety treatment would be very different than my anxiety treatment, because the reasons for our anxiety, the pattern that our anxiety presents with is different. So I don't do the anxiety treatment.
Right.
I do your anxiety treatment, and that looks different for every person according to how it feels in your body and versus somebody else's body.
Which is so fascinating to me. So let's take that as an example.
Yeah,
right?
sure.
So how would you treat my anxiety versus your anxiety differently? Is it the needles are going in different places?
Sure.
Or are you asking me different questions?
Yeah. Well, the first thing I would ask you if we were treating anxiety is tell me what that means for you. What does that feel like? When you get anxious, do you get heartbeats in your chest? Do you get heaviness in your chest? Do you get a little pit in your stomach? Are you overthinking? Do you get short of breath? Do you get a hot flash when you get anxious? What's this feel like, and what's this experience like? So finding out what their experience is like somatically is very important. And then, of course, I go into tongue and pulse diagnosis, which those are pieces of the big puzzle. We never look at one thing. We never cling on to one thing. That's a rookie move, right? That's what lesser experienced acupuncturists do. They cling on to one thing and go with it. But we need to take a step back and look at the whole picture, because then a pattern emerges. And so everybody will present, even if you feel pretty good, you're going to have an underlying pattern of disharmony. Everybody has one.
Right.
And so we need to find out what that pattern is. And then we take that pattern, and it's usually an energetic disharmony of the Zong Fu system, which means the organ system. And so we take that harmony or that disharmony, and we build a point prescription, we call it a collection of acupuncture points that addresses that. And I think that encourages the different systems of the body to interact with each other in a more appropriate way. Our bodies get distracted. We're out in this wild world with all this stimulation, and our bodies forget what to do. They forget how to self-regulate, because your body has the answer.
Right.
And that's what we do. I don't like to take a lot of credit for what I do because it's really your body that's doing it. I just set you up for a healing episode, and you take over from there.
It's so crazy. I've had a common thing is sleep, right? And I recently went for acupuncture to get better sleep. And, and I know it feels weird for most Westerners to think that, putting needles in your ear is going to help you sleep. But can you talk to me a little bit about the fact that it's not necessarily like, if you have issues with your heart, you're actually treating just the heart or whatever it may be.
Right.
That you are treating points on the body or the meridians that are associated.
Yes.
Can you explain that concept a little bit?
Yeah, totally. Well, it's a big question. There's a lot of different kinds of answers.
I know, sorry.
No. So if you don't mind, can I take you through two answers?
Yes, please.
And so listen, these two answers, I like to think of these two answers as kind of like saying the same thing in two different languages, right? So we have I love you and we have te amo. Those both mean I love you, right? But the sentence structure is different, the words are different, the pronunciation is different, the accent's different, they're very different, but they mean the same thing. And so we can look at East Asian medicine philosophy and treatment principles as one language, and Western medicine treatment and philosophies as another language. We're saying the same thing in two different ways. And there's some things that don't translate, and some things you can't really translate well. So if we're looking at the heart, for instance, and by the way, when I say that you have a heart issue and that's what we're treating for anxiety, I'm not talking necessarily about your cardiovascular heart. I'm not talking about the pump that moves your blood around. I'm talking about your spirit heart, your Shen. And people sometimes that's a hard pill to swallow, but you know what? It's funny. Not too long ago, they started prescribing a heart medicine for anxiety. Did you know that? Isn't that funny? It's almost as if the heart is an emotional organ. And now it's very, very common to prescribe things like beta blockers for stage fright. Right?
Wow.
So
Right.
the Western medicine folks are catching up to us. They're starting to realize that this ancient wisdom has a place and is solid, and it's grounded in science, because magic is just science that hasn't been discovered, right? So anyways, I digress. If we're treating the heart, we typically want to, the heart in regards to a psycho-emotional issue, we want to determine whether this is a excess condition or a deficiency condition, okay? Deficiency condition is usually lower energy. It usually presents with a weaker pulse, a paler tongue, a more subdued demeanor in somebody, and usually fatigue is an underlying condition, underlying symptom. An XX condition is more of the opposite. The pulse is big, rapid, wiry sometimes choppy. The tongue may be bright red or maybe purple, or it might have scallops. It might be, more excess looking. And the symptoms might be excess. Anxiety, most of the time, tends to be an excess condition. Depression tends to be a deficiency condition, although there's examples of the opposite in both of those. It tends to be very nuanced. So, for instance, we might diagnose you with something called heart fire, okay? And heart fire is a kind of anxiety that looks similar to high energy anxiety. It looks similar to mania. And the telltale sign of heart fire is a bright, flaming tip of the tongue. Looks like somebody put a clown nose on the tip of your tongue.
I've seen that.
Yeah, right? And with heart fire, there's other organs that interact with heart, one of which is kidney. Kidney and heart like to interact with each other. They both have fire elements. Kidney has a big water element, and sometimes with heart fire, there's not enough kidney water to keep the heart fire in check. So you can't just drain fire from the heart with a series of points on the heart channel. You also have to boost water in the kidney to help control the heart fire. So it becomes a situation where, we want to clear fire from the heart to treat the anxiety, but we want to treat the kidney because that's the reason for the anxiety. Does that make sense? Mm-hmm. So we want to bring in both the issue and the reason for the issue. Okay. So that's that. That's sort of.
Yes, that's one of my favorite things about TCM.
Isn't it?
Kind of that approach.
Yeah.
Yeah.
Yeah, totally. And I hope that's universal.
No, it's true, right?
Yeah.
But I feel like that's in many aspects of life, right?
Yeah.
That we tend to put Band-Aids over things as opposed to really getting to the root cause of why is this happening to begin with.
Sure.
So you have many patients that walk through here
Mm-hmm.
with a range of different issues, of course. And we're going to get to see you work with Zoe. So can you give me an example of how you are approaching what's ever ailing her? And because it's also a continuous treatment, form of treatment, right? It's not like a one and done type of thing. I think that many of us have become conditioned to, you have a headache, take Tylenol, and it'll be gone in 20 minutes, right? But this is not that. So can you walk through kind of your process on how you approach your treatments?
Well, the first step when deciding what I'm going to do is determining what the situation is, right? So every treatment begins with a solid diagnosis, okay? And that's always, from my perspective, in East Asian medicine diagnosis, that's an organ disharmony usually, or sometimes a channel issue, right? So for instance, if you have a headache right there, that's a very particular channel, so we're probably going to work on that channel or a related channel because it's a very particular spot. So we come up with the diagnosis, and then what we do is we go through our collection of acupuncture points, which there's over 400, and those are separated onto 12 different acupuncture channels. Every acupuncture channel is attached to, innervated into a particular organ. So we have the heart channel, the small intestine channel, liver channel, gallbladder channel, and on and on and on, one for every organ. There's 12 total. And so every acupuncture channel has a different personality. How I think about all these points and all these channels is the channels are like different departments of a company, and all the points are the workers within that department. And I need to call upon a set of workers to deal with this problem. They all have a different affinity, they all have a different personality. So I come up with the diagnosis, I pick the channels that I'm going to work on, and I pick the points within the channel. Acupuncture channels are kind of predictable in one particular way. The farther you move down a channel, generally the stronger the point gets. So that's why you'll see acupuncture treatments.
What do you mean further down?
So the points that are closer to the feet are generally stronger. and the points that are closer to the hand. That's why if you go for an acupuncture treatment, a lot of the time they're going to do a lot of work from the elbows down, from the knees down, because those are particularly powerful points. And you might notice, like all my patients do, that oftentimes those points are very, very far away from the problem. But they're on the acupuncture channel that's associated with the problem that we're trying to treat. They're associated with the underlying pattern that we're trying to treat. So after I come up with a solid diagnosis, I come up with a solid treatment plan, which is a point prescription. Usually all my treatments start with acupuncture, which is anywhere from 10 to 20 needles. 10 to 20 painless needles, I'd like to add. And, obviously sometimes you feel some points more than others, right? They're needles, they're not kittens.
Right.
They're going to be a little pokey sometimes, but acupuncture doesn't have to hurt for it to work. And the needles,
and it doesn't, right?
Exactly. The needles that I use are so small, about 20 of them can fit inside of a hypodermic needle that you would maybe get a shot with. So they're very, very tiny. And then needles go in and patients rest for about a half an hour. Half an hour is about how long it takes for the needles, the chi in our bodies to do one loop. Okay, and you've probably noticed this getting acupuncture. At a certain point, everything kind of just turns off. Like the chi movement, it kind of stops. And that's really when your treatment's done. And that happens generally at anywhere between 22 minutes and 26 minutes. I usually round up to about a half an hour. And then once the treatment stops, once the chi stops moving and I take the needles out, people get up. I will often prescribe herbs and other things, maybe exercises, often dietary recommendations if patients are open to hearing that information. If I need to. Sometimes we don't need to. Mm-hmm. Sometimes needles are enough. I don't push medicine on people that they might not need, and people respond differently. I've run into people on the street, and this isn't just a me thing, this is just an acupuncturist thing. I've run into people on the street, and they say something like, "Dr. Peacock." I'm like, "Yes." And they say, "I met you 9 years ago." I'm like, "Oh." And they say, "You treated me one time." And, that was 30,000 treatments ago, so I don't remember. And I say, "Oh, great." Thinking to myself, "Why didn't you ever come back?" But then they say, "You treated me once and that issue never bothered me again." And I say, that usually doesn't happen, but sometimes it does. And sometimes we don't hear those stories because they go off and they live their life,
right.
But usually people need a few treatments. And it could be anywhere from 3 to 5 for, low back pain that just came on a few months ago, to 3 months of weekly treatments for something more serious like endometriosis or PCOS or something like that. Right. Usually we can do a good job regulating a menstrual cycle in 3 months of treatments, within 3 months.
Wow.
Sometimes sooner, sometimes longer, but generally we can get a lot done in 3 months.
That's amazing.
Yeah.
That's just so amazing, and this is part of why I'm doing this, right? Just so that people know that they have options, and that there are different approaches to different health, ailments that people might be suffering from, and this is where it kind of brings me down. This is a little bit full circle, I guess, because your approach is to really bring it to the community here in Queens. And it's less, because we have seen the whole range, where you can, as you were saying, you can have your silk sheets and your silk pillow while you're doing acupuncture and pay a lot of money. And there is a place for those kinds of acupuncturists as well. Yeah. And I think that that's really important. To know that it can be accessible if you look. So can you talk to me a little bit about Rooted Refuge?
Sure, yeah. So our idea was that we wanted to have a space that was accessible both for the patient and for the provider. Okay, so what we did was, it's myself and 4 other acupuncturists, and we're part of this group of practitioners that we call the Rooted Refuge, in this space that we also call the Rooted Refuge, and we all share overhead and resources and supplies. So we've driven down the overhead. Okay, so there's not one person that has a summer home. right? There's all of us partake in the savings of having this huge, not huge, this relatively large space together, right?
Well, so, huge by New York City standards.
Exactly. So guess what we can do? We can lower the price for patients. So I work under a sliding scale. My sliding scale range is 70 to 125. I don't police people in what they pay. I encourage people to pay what they need to pay so that they can afford to come back. Okay. One thing I do, which I tell people about, you won't see this on my website, but the extra money that people pay outside of the lowest, more than the lowest, I put aside and I use that money to further lower the treatment price for people who really need it. And I also often will do things like free clinics. The next one is on December 25th, Christmas Day. And I'm going to, a couple days before Christmas Day, I open up the scheduling and anybody's welcome to come for free treatments on Christmas Day.
Wow.
And I'll bring snacks. I'll probably have hot chocolate, probably have pizza, by appointment only, but everything will be completely free. That is paid for by extra contributions through the sliding scale. So it's not me, doing God's work. I'm getting paid for it, but it's with the extra. But you're
still, you're not making millions by doing a free clinic.
It's true.
So,
it's true. But, I don't need millions either. You know what I mean? I have what I need, and, I think that, especially with the people that I'm working with, I really think it's time to take care of them. Because whether you know it or not, they've taken care of us. The queer nightlife people and the service workers and the blue-collar folks and the laborers and the immigrants and the queer people and the trans people, all the people, those are the people that really give this city, New York City, its heartbeat.
1000%.
Right, and we're enjoying everything.
How would people know what to wear?
To the Rooted Refuge?
No, like in general
exactly,
New York
right.
City with us community.
Exactly, right? And so we're all enjoying their contributions, and we're not paying them for their contributions. And so we wanted to have a place for them. Don't get me wrong, everybody's welcome. And I do have a lot of people who are very well resourced who come to my clinic. But the clinic is here. It centers the experience of the artist, activist, queer person, and in society, and how they're not given their due.
Well, I think that acupuncture, feels like a huge barrier for a lot of people, and the fact that you've lowered that barrier is huge. It cannot be overstated. Like what you're really doing for the community to be able to, and like you say, it does have this domino effect, right? When you have a healthier community, or when you have a community that's more health conscious, let's say, that ripple effect is amazing, right? And it will extend to their families and their friends and whatnot. So I'm really grateful to you to be doing that and doing amazing work here and connecting all the people and giving access and stuff. So if people want to know more about the Rooted Refuge or about you, where do they go?
Yeah, rootedrefuge.com. It's as simple as that. All of my contact is on there. All of everyone's contact who works at the Rooted Refuge is on there. You can book on the website. It's very, very easy to book. It's very easy to contact me. I encourage people always to reach out with questions or concerns. I'm always available. I'm answering emails all day long, and I'm happy to do it. I love hearing from people. So that's how you do that. Okay, so Zoe has a couple things going on historically. So one of her patterns, one of our underlying patterns, is usually something we call liver chi stagnation, and join the club. This is sort of the New Yorker pattern, the stress response that a lot of people get from being overstimulated, from being very, very busy. Oftentimes, but not always, this is the pattern that contributes to things like PMS, contributes to things like anxiety, sometimes depression, sometimes insomnia. So it's one of the big players in this city. I'm not sure how it would be in Kansas. And I like to do tailored treatments, but if all I did was treat liver chi stagnation all day long, I would probably get it right 70% of the time. But Zoe's a little more complicated than that because she also has lung stuff going on. So she has a history of asthma. We're in the lung season, so lung ailments are going to flare right now. And lung and liver can interact with each other in a very particular way. It's something we call wood insulting metal. So it's when liver qi stagnation makes the lung issues worse. So we have the lung season that we're in. We have her underlying, constitutional pattern, I'll say, of liver qi stagnation that often beats up on her lungs. She was just sick last week, so she actually had a lung thing. And when people are sick, usually what happens is the pulse floats to the surface. We call it a floating pulse. And hers isn't floating anymore, but I'm sure it was a few days ago. So I just bring this up because that means that she's sort of out of the acute illness, but she still has this like residual lung stuff happening.
So when you say floating pulse?
Yeah.
What does that mean?
It's cool. I would describe it in two ways. You just put your fingers very, very lightly on the wrist, and it kind of feels like dolphins jumping out of the water. The pulse comes up to meet you. Other people describe it as like a log floating in a river. And when you push, it disappears underneath the, so if you feel it, but then when you push down, it disappears. So that's a floating pulse, which she doesn't currently have, but I'm sure 5 days ago she did. Now, her pulses, especially the lung position and the spleen stomach position, those two.
So is that what you're?
Yeah, so this side is the chi side. So I'm using 3 fingers, and 1 for each position. This position reflects the energetics of the lung. This position reflects the energetics of the spleen and stomach, aka digestive organs. This position reflects the energetics of the kidney yang or kidney fire, or sometimes people translate that to the adrenal glands because those sit right on top of the kidneys. So this is a good kind of snapshot of all those different organs and how they're interacting with each other. There's some residual inflammation from this cold, which is, I think, what is showing up in the lung pulse. It's a little bigger than the rest of the pulses. Her pulses are a little bit faster, which implies inflammation. And then the second position is slippery. And slippery pulse feels like pearls rolling around in a saucer. That's what all the textbooks say. She's not expressing any phlegm. It's now more of a dry cough, but that's because when you have inflammation mixed with phlegm, it congeals and it dries. And so we want to try and break that up a little bit because it's becoming dry, and that's because it's stuck. So yeah, we've got our work cut out for us.
Okay, so what are we doing today then?
So we're going to work on 2 primary channels. So we're going to work on the liver channel, we're going to work on the lung channel, and we're going to start with a couple of points on the ankles. And the reason we're starting with these 2 points, so these points are right here next to the bone. The way we find this point is we take our hand and we put it next to the medial malleolus, which is the little bump here on the ankle, and it's right where the index finger is. And then you feel around, and I've been doing this long enough, I can actually feel the point. This is an important point because this is the intersection of 3 different acupuncture channels, one of which is the liver. So it gets a lot done. It's 1 point, but it kind of has the power of 3 points. So it's a very common point. We call it spleen 6. This is also the point that we will use to help somebody have a baby when their due date has arrived, because this is also a point that stimulates the uterus. Twist. Now when we twist these needles, the fascia wraps around the needle like spaghetti around a fork, and it makes the channel more conductive. So this kind of sends a message to the body and encourages it to self-regulate, because her body knows what to do, but with stimulation, New York City life, our body sometimes gets distracted, and this reminds it. The third point on every acupuncture channel, on every yin acupuncture channel, is always what's called the source point. And this is a point that strengthens the organ that's attached to. So this is the source point of the lung channel.
And so by doing this, you're clearing the channel.
Yes.
So for better blood flow.
Better blood flow and to move the channel because it's stagnant, but also another way to explain it is to encourage her body to do this when I'm not around. So we're educating her body so that it can self-regulate on its own. So the next point I'm going to do in your legs, this is probably the most famous acupuncture point. It's stomach 36. The Chinese name is Zhu San Li, which means 3-mile leg. And what that means, I guess in a metaphorical sense, is when you needle this point, people are going to have so much energy, they're going to be able to run an extra 3 miles. So it's very, very important point. This is sort of what I call the grand central station of acupuncture points. There's a lot of connections, there's a lot of things. It's really, really wonderful. In this case, we're using it to help her immune system recover from this illness she just had. The Ren channel goes right up through the chest, so this is always a good channel to open up when there's chest issues. So just two Ren points. 80% of people get these 2 points. These are 2 points on the ear. These are called Shen Men. And Shen Men is essentially the point that's going to bring people out of fight or flight and pull them into rest and digest. Because we could all use a little nervous system regulation. These are both at the elbow, these 2 lung points. The same point on both sides. These are lung 5. Lung 5 is a point that's indicated to pull heat out of the lungs, so to clear phlegm heat in the lungs. Generally, between 10 and 20 needles is perfect. Any more than 20, that's too much information. It's too much information, the body can't integrate it as well. Any fewer than maybe 5 or 6, and it's kind of not enough information. And so now, Zoe rests for about a half an hour.